Hi, my name is Angelique Montano-Bresolin. I'm a pelvic health physiotherapist, and today we're going to talk about the connection between menopause and vaginal health. So, when we talk about menopause and vaginal health, we can't really talk about one without talking about the other because they do go hand in hand. So, the first thing with regards to vaginal health is during menopause is that there can be a lot of irregular periods, and this is very common. Irregular periods are as a result of fluctuations in hormone levels, and so there tends to be some changes that go along with this transition in life. Another piece that is really important to consider is bladder function. So a lot of people don't know that when you approach menopause that your bladder function can actually change. Some people start to experience more issues with urinary leakage, or in other words, urinary incontinence. And others will also experience more issues with more urgency and frequency to have to urinate. And that's because there are some changes that occur in the tissues around the vagina when there's a decrease in hormone levels. So some of these tissues will start to become very thin, a lot more less elastic, and this can really contribute to altered function for the bladder. The other piece is that there can be some weakness in some of the muscles in the pelvic floor, and this can also contribute to a lack of support around the bladder and the urethra. Another change that occurs in and around vaginal health is vaginal dryness and irritation. So again, hormone decline can increase dryness in this area, and this can result in all sorts of symptoms, including pain with intercourse and pelvic pain. Because obviously, if tissues are dry, there's more friction, and this can be very painful for people. Another issue is light bleeding and spotting that can occur when tissues are dry. And that really makes sense because if you think about your lips, and if your lips are super dry and you try to smile, your lips can crack. And the same thing can happen in these tissues around the vagina. And one other thing that can occur is an increase in urinary tract infections. So when there's a decline in progesterone and estrogen levels, there can be a change in the pH balance in the vagina. So typically the pH balance is more acidic, but when the pH balance becomes more alkaline, then that can make one more susceptible to bacterial infections or urinary tract infections.